Hi, Anna. Thank you for zooming in with me on this
Well,
lovely
thank you
day.
so much for joining me. Thank you so much. I'm so glad that you're here. We've been friends for so long, and I just want the world to know how wonderful you are.
Well, thank you. I mean, we did meet in 2002, way back in the day that we started education and nursing.
Wow, we're so old, Lionel.
Well, we are getting there, right? But we're still very vital to the healthcare world.
We are, and we're young at heart.
Absolutely.
Like when I see you, I feel like nothing has changed since 2000.
Nothing does change, but everything does at the same time, right?
It's true. Yeah, it's true.
Yeah.
So go ahead and introduce yourself. Tell us who you are and what you do.
All right, so I'm Lionel Tancrede. I am a registered nurse, and I graduated from the nursing education program of Saskatchewan through the U of S in 2005. And when I graduated, I guess before I kind of give you that bit of background, I entered nursing knowing that I was gay, and sometimes there's the preconceived notion that all men that go into nursing are gay. And I mean, that's one of the barriers I think that we still struggle in men coming into the role of nursing. We still don't have high numbers of men entering into the profession. So I find that still yet very disturbing after, being in healthcare for 15 years that I haven't really seen a change in the numbers of students coming into the program or nurses identified as men in nursing.
Yeah, thanks. I think I want to ask you more about that, but I'm interested in hearing about the places that you've worked and your education and things like that.
Sure. So so like I mentioned, I graduated in 2005, and from that time, I worked primarily full time my whole career to this date, but primarily focused in the area of psychiatry or mental health, both in community and in acute care. First, starting off my career in acute care mostly, in combination with cardiac areas of nursing. And so I was also a critical care nurse in coronary care for about 18 months. And so that was really the first sort of journey in my healthcare career as a nurse in the province of Saskatchewan and mainly in Regina. 3 years into practice, I did decide to go back to school because there's an opportunity to join faculty with the College of Nursing to teach nursing, which is also a passion of mine. And so I went back to school and started my master's degree at that time, so about 2008. And completed that degree in 2 years while working full time teaching with, at that time, SciAst, our college in the province at that time. After I completed that and worked in faculty or as faculty for the college for 3 years, so there was opportunities in the health regions at that time for leadership. And because I spent most of my master's career studying leadership, and the different roles that nurses play in the roles of leadership, I decided to pursue leadership types of roles or what are sometimes identified as leadership roles. So primarily management types of roles in the healthcare industry. So I started that as a manager at Pioneer Village, which was a long-term care facility where my primary responsibility was in mental health and a long-term care unit. So I spent about 18 months in that role and then had an opportunity to go to acute care doing the same sort of work as a manager. But the demographics or population was quite different for me. I had never really worked with the adolescent population, and that's the role that I took on as a manager, was adolescent mental health. So I spent 5 years in that role as a manager, leading mental health in the adolescent population world, and spent so much of my resources learning about leadership and really truly about collaboration and working with partners, different agencies and partnerships with education and social services, because we all linked so well together. So I spent the majority of my time in that role fostering those relationships to better enhance how we support students reintegrating back into education. How do we support them if they're low socioeconomical status with the supports of social services? And even, at times with social services, It's often perception as well that if you are going to social services, it's because you require that financial aid, and that's not necessarily the case. We have at times, and one of my greatest learning was reporting potential neglect or abuse in a family home unit, whether it was with that particular teen that we were working with or other family members within the home environment. So lots of work there that still needs to be fostered for sure. During that time as well, brought on the addictions for the province for adolescent populations, which was certified unit where we kept the youth for an X period of time, maximum 15 days. So we brought that from community into acute care. And then the last 2 years, I rejoined faculty with the Saskatchewan Collaborative Bachelor of Science of Nursing, the SCBSCN program that is in collaboration with the U of R, and I'm faculty currently with Sask Polytech.
I'm always amazed at the broad and diverse range of experiences that you've had in nursing. It's just amazing what you have accomplished in what.
Well, and I don't know if it's, gender that helps with some of that, or the diversity that I can bring to be included at the table, that they see the potential there for what I can contribute in healthcare. But I've had so many various different opportunities. I should also mention that I did spend part of a term. Wasn't able to complete my term as a member at large on the SRNA board, and so that was a very vast and experience to be a part of leading the way provincially with a group of members that sat on the board.
Yeah, it is amazing what you have done. And I guess further to that point of diversity and inclusion, which is what we're talking about today, why you're here, I wondered if there's been times in your career that you have felt that you couldn't express who you are, or be who you are, or times where you've felt perhaps more vulnerable than, the other average nurse.
Yeah, I guess I really, there were times for sure that I felt like I was maybe singled out or, maybe not included. And that had really probably started actually as a student in the nursing program, where I felt alienated for being a male in nursing, particularly in third year when I was when we were in our labor and birth sort of education process, and the clinical elements that went in that, and how do you respect women who are antepartum and laboring, and still provide education opportunities to male students regardless of their sexuality. But really, that was the first time that I felt really alienated and isolated as a male in the profession of nursing. And being a profession, I really felt that it wasn't being handled very professional in how we manage student learning and those opportunities.
Would you be willing to share an example of something that happened along the way, or?
Well, I just felt that at that time that the opportunities were given more to the female cohort of my student peers at the time, where I felt that I was actually in the back room studying textbooks in a clinical environment, which I thought was not the best source of teaching and learning. And I had made that as a comment in a statement in a different environment. And it actually got back to the college because I was becoming vocal about missed opportunities, really, and what were and I get the premise around a bachelor degree in science of nursing is that we have a wide range of experience and knowledge base, but if we're not given the exposure to learn the clinical aspects, particularly in women who are pregnant and laboring, I could be in a very remote and rural location where I am the only nurse, and I now felt at that time that I didn't have the skills that I could go into that environment to work. And probably it's the reason why I didn't really venture out much. in
Well, I
rural.
mean, when you think about it though, what percentage of OBGYN students are male, right? What percentage of respiratory therapists that work on labor and birth are male? You know, it just, you don't even have to be a nurse to understand that that's
Sure,
fairly.
but I mean, some of it is the societal perspective of it, right? And so, but then again, that's where I think we as nurses need to sort of change the culture when we're working with clients about the exposure of students and what this means in terms of teaching and learning and education purposes. And I think that experience in itself has taught me how to be a different faculty as an educator in the nursing education program. Um, at the time when I, was teaching in the NEPS program as well as my current role teaching now, um, that gender is often still perceived as an issue in nursing.
So how has your teaching practice changed? What messages are you giving undergraduate students now to change these preconceptions about, men and women in nursing?
It really comes to an understanding of spending time with your client and developing the relational practice. I think that's the vast majority of where I spend my time is in teaching students is about relational practice. If you develop that trust and the bond with the patient that you're working with, or the resident or client, whatever sort of environment that you're working in, you can actually do so much more with your resident or client patient that you're treating. And because you've established the fundamental elements of nursing, really, which is a therapeutic relationship. And we often get so focused on a task, a task, a task. And we're limited in mental health in terms of task orientated work because we're not doing Foley catheters, we're not performing intravenous therapies, we're not drawing up medications like you would in a med-surg unit. So the work is different, but the work is equally important. And particularly now with our pandemic of COVID, we're seeing more and more mental health, not just in the mental health realm of healthcare, but we're seeing it in every aspect of healthcare, from public health, um, you know, acute care, long-term care, medicine, surgery areas. I mean, it exists and we can't be blind to that. And it's why I'm really passionate about mental health being as core curriculum in nursing, because students are often afraid of the area of psychiatry care or mental health, but yet every student will be impacted by it some journey along their nursing career, if they haven't already in their personal lives.
Yeah, it's very true. It's something that every nurse needs to be able to integrate into their practice, I think. Yeah.
Just as much as I integrate physical components into psychiatry care. So just because we're in a mental health rotation where I'm providing the teaching and education and knowledge translation of mental health concepts with our patients, and we get to see firsthand the impact that mental health has on the human body, so too are some of the limitations in terms of physical care. And so I am always bringing an aspect of physical care into the realm of their concept of healthcare.
Yeah, it's very true. I just want to get back to talking about you for a few more minutes before we finish up. Getting back to diversity and inclusion, sort of the male-female divide, and maybe the fact that you're gay or whatever, I don't know, but I'll let you speak to that. But I just wanted to know what message would you tell new graduates about working with other nurses who are perhaps different than them, or
Yeah, sometimes when you feel like you're maybe different, or you identify your sexuality as part of you as a person, I think the one thing that I remained clear in my profession in nursing is my code of ethics plays such a valuable role in how I conduct myself as a registered nurse. I am so proud to, and I wish we were actually in a standard uniform back in, from the early on years before the 80s, where standardization of uniforms really helps with the profession, I believe. I put on my uniform, and to me, it's just a uniform. If I had a sort of a standard uniform that all of us looked like a nurse in regards to we all wore the same sort of color uniform, style of uniform. It really changes for me my perception, I guess, of the profession in which it stands in terms of nursing. However, feeling alienated or isolated at work or different from others at work because I might be gay or I am a man in nursing, I stand true to the true reason why I'm at that workplace. Although we develop cultures in the workplace around relationships with our peers and our colleagues, and friendships develop over time, at the end of the day, it's the public that pays my wage to be at work. And at the end of the day, it's really my opportunity to build that relationship with the patient more so than the relationship with my colleagues and peers. And so sometimes I have to do that little bit of balance and check at the end of the day, or maybe it's in the middle of my shift that I'm working. And when I'm starting to feel, is this really about me, or is this really about, am I starting to personalize that my sexuality is coming into play? My sexuality of who I am is a part of the person who I am. It's not the whole entire being of who I am. And so when I'm at work, and the role that I play and the role that I am as a registered nurse has to be at the forefront. And of course, people want to understand who you are. So sometimes that has to be sort of navigated carefully so that it doesn't, I guess, become a hindrance in your ability to remain professional in the workplace.
You know, Lionel, I just want to thank you so much for your transparency and your wisdom and your brilliance. I've known these things about you for many, many, many years, but I just want to thank you for taking the time today to come and share your insights and really share who you are and what you believe in and your commitment to professional, ethical nursing care. So thank you.
Well, thank you, Anna.